You've had a C-section, and in the next, like the 3 to 6 months after that C-section, you develop back pain. It is not random. These two are directly related. So I want to explain it to you and show you what you can do about it. So for this, I need a model. So I'm looking around. My wife just happened to be there.
Wow, this is incredible.
Okay, so turn sideways like this,
Yeah.
and very good. So find yourself a string. I have a computer plug, and to show
Super sophisticated.
ways. So if you put the string on the stand normally, if you put the string with the center of the on the head here, you should touch the back here. You should touch the bum bum, and you should have 2 fingers here, 3 fingers in the lower back, and that is a straight back. Okay. Now, what happens when you get a C-section? You know the reflex that when the doctor tap on your knee with this little rubber hammer and then your leg kick. This is your reflex. It tests your reflex system. That is everywhere in your body. You know, you're watching a movie and you're falling asleep. You want to make sure you don't fall asleep. You stand like this, you fall asleep, and at some point your neck snap back. It's the exact same phenomenon, meaning your brain is delegating to your muscles how they should position themselves to keep you in the position that you have chosen. So all of this is delegated to your posture. So your posture is sort of, you can control it, but if you stop thinking about it, it's sort of involuntary, unconscious, it happens. It's using that kind of reflex. So this reflex is everywhere in your body. So if you have a C-section, and as they suture all the tissues, your skin gets attached to the tissues below, gets attached to the muscle. That means every single time that you move, the muscle is pulled, and just like with the hit of the rubber hammer on your knee, it triggers the contraction of these muscles. So as these muscles are constantly contracted, it basically makes the belly to go forward. It creates an hypercurvature on the back. So turn back, and then so turn your feet inside like this. Like turn your feet like this. And if we do this, come back here, and you will see immediately now you have 4 fingers in the back. So it creates an hyperlordosis, so hypercurvature of the lower back, which is going to change basically the angle of the pelvis, which is going to create a strain over time. That will be the cause of your back pain, and it will tend to also make your feet become valgus, so meaning your ankle will turn inside, and then it create then ankle, feet pain, or leg pain. And all of these are related. Your posture will have completely changed within 3 to 12 months because of that C-section. So if you want to see if it works, if that's the case of your back pain, take a cube. So have somebody make these measurements on you to see what is the curvature of your back. Then take a cube of ice, pass it on the scar. It will freeze the scar, and it will freeze. It will numb it, so it will no longer trigger that contraction. Then you measure your back, and if you see that the distance between the string and this curvature in the back has changed, then that means that scar was triggering a contraction here and changing the angle of your pelvis. So now you know that it's a problem. So now you need to remove all the adherents under that scar. So you oil it a little bit, and then you start to really massage that scar. You need to tear the surface tissue, the surface adhesion with the lower tissue, with the muscle. So don't go to the place where it's like too painful. Don't go to the place where you're creating like bruises, but really massage it deep enough so that over time you're going to tear that tissue. There is a surgery that can be done for this, but I don't know if it's available in this country. They basically take a needle with a really high jet, powerful injection of lidocaine, so you don't feel the pain and the pressure. The liquid acts as a knife, and you can free the skin on top of these muscles. But if you don't have access to this, just do a deep massage and try to remove these adhesions as much as you can, and it's going to reverse your back pain.